Okay. Well, I tell you, we're going to go ahead and call to order the May 10th budget review session. We've got a few members of the committee that are working their way back into the chamber. So we're going to go ahead and turn it over to our Deputy City Manager, Pam Hodge.
Good morning. I think it's still morning.
Surprisingly so, yeah.
I know, it's still morning. We have passed out the review schedule just so you have an updated schedule. On the agenda for today is Parks and Recreation, Planning, Engineering, and part of Engineering will do a GIS update because of the move from Engineering to IT. So we'll have GIS as part of the Engineering and IT update, the Trade Center, and then Recorder's Court. We do have Judge Solinsky coming around 1 o'clock, so hopefully that timing works out for him. Otherwise, we might need to reschedule Recorder's Court, but we'll see how the time goes. We've also passed out the responses to the questions from the last budget review session. And if there's any questions on the information we've provided to you, we'll be happy to do any follow-up information on that. Okay, so at this time, we'll go ahead and get started with Dr. Worsley and Parks and Recreation. We have invited the task force, and because of the time change, they'll be here in about 10 minutes. So as we get into the presentation, if there's any questions for the task force, they'll be here shortly.
Okay.
Good afternoon, everyone. Thank you so much for being here for our budget review FY17 presentation for the Parks and Recreation Department. We're ecstatic to be here today to talk about the future of Parks and Recreation for this upcoming budget season. I'm sure that many of you are aware of the different divisions within Parks and Recreation, but I just want to highlight this just in case we have some new citizens watching by TV or live stream. Our department is made up of various divisions such as the Administration Division, Recreation Services, Park Services, Athletics, Aquatics, Community Schools, and Special Facilities. And in each of those divisions, we have several legs that go along with that, which you have presented here before you as well. So I wanted to have the opportunity to share that with you too. In terms of our FY17 budget, our request this year is $11,295,817 for FY17. Within this particular budget itself, our personnel services are $7,116,621, which is about 66% of our budget. The remaining 34% represents our operating at a little over $4.1 million, and there's zero capital in this particular budget. Now I'd like to chat a little bit about the Columbus Aquatic Center. In the Columbus Aquatic Center, and which you may recall from our mayor's budget letter as well, we are definitely in support of the budget as it referenced the mayor's budget letter. The funding for the Columbus Aquatic Center, we do have a revised management structure that you see here before you. As the director of the Parks and Recreation Department, the Columbus Aquatic Center would report to the Parks and Recreation Department. As a dotted line out to the side, to the right, you see the Columbus Aquatics Commission. We do understand and are in support of the Columbus Aquatic Commission. We will continue to work with the Columbus Aquatic Commission to make sure that our facilities are successful. As it relates to the management structure even further, the Aquatic Center manager will be the person that will provide the overall elements of the Columbus Aquatic Center. This person will, of course, do the hiring of the individuals that work at the facility, also managing programs, all oversight responsibilities, and reporting directly to the Parks and Recreation Director, which is myself. We will make sure, as previously stated in previous council meetings, that the CAC Commission is actively participant and involved in the hiring process and selection process for the Columbus Aquatic Center manager. As well, we have 2 assistant aquatic center managers that you see here, the program supervisor and the facility supervisor. These individuals will report directly to the Columbus Aquatic Center manager as well. We do want to point out that this management structure, as noted also in the mayor's letter, is about $15,000 less when compared to the previous management structure in terms of savings, so that is a plus. Other aquatic center positions that will support the Columbus Aquatic Center are listed here for your viewing. Administrative clerks, park maintenance worker, custodian, park maintenance worker 1 custodian, and lifeguards. Majority of the employees that work at the Columbus Aquatic Center, as you see, would be part-time, with the exception of the park maintenance worker 1, which is a full-time custodian. This person currently does not have benefits at the Columbus Aquatic Center. And here it shows you the grade, the number of positions that we have, and whether they're part-time or full-time, and the hourly rate that's associated with that as well.
Excuse me, Dr. Worsley.
Yes, sir.
Counselor Thomas?
Dr. Worsley, of those on that list, are any of those new positions?
No, ma'am. These are positions that we currently have that's a part of, we pay them out of our current aquatic budget.
Okay, at the previous slide, those were those 3 were new positions, but these are all continuing positions, right?
That is correct. The one on the first line, the assistant manager, 2 assistant managers are new, the aquatic center manager are new. Here, in terms of the administrative clerks, we have individuals that are currently working over there that are pulled out of our Columbus Aquatic Center budget. Currently, we would use those monies that we, I'm sorry. Okay, well, I'm answering it incorrectly. Yes, it is. It's new in the budget, as the finance manager points out. I was referring back to how we currently have it set up currently, so I apologize for that. New in the budget, that's correct, new positions.
You need to explain that.
Yeah, that doesn't make...
Explain that because, let me see if I can explain it correctly. This funding was there, and it was for the third-party vendor. The third-party vendor contract ended, and so those funds were then in some way that Pam can explain, transferred or being used by Parks and Rec to fund and pay for the lifeguards and the whoever else they have there. So those positions are not housed in Parks and Rec right now as a formal part of the budget. It's sort of a hybrid of makeshift, make it work, because of the transition regarding the ending of the contract, is my understanding. So it's not new monies, it's just monies that will have to be assigned formally to Parks and Rec in the budget system that used to be under a vendor contract. So if that's not correct, correct that.
Yes, that is correct. These are funds that were part of a contract, but these will be adopted as new positions in the Parks and Recreation Department, since there's not a contract in place or a contractor.
So they were funding those positions through the contractor. When that ended, they had to be funded through Parks and Rec, and they're Parks and Rec's employees. And so if we do this, we'll have to make that formal adjustment.
Okay. Just curious why the admin clerks are part-time, 5 part-timers, rather than any full-time clerks. I'm just curious.
It's been our experience. We don't necessarily we have the full-time employees, we have to look at benefits. The costs associated with that would increase dramatically. And so we use the part-time staff because we are able to overtime pay a little bit less and cover a little bit more hours with regard to 89 hours per week.
Okay. Okay, thank you, Mr. Chair.
Mayor Pro Tem?
Good morning. Well, good
Good
afternoon.
morning, good afternoon.
The one full-time employee that we do show, why is that person without benefits?
And the transferring, this is what we've had in the old system, so the new person will have that. Okay.
I said full-time.
In the old position budgets, we had a person with no benefits, and I have clarified that we would have this person with benefits going forward in the new position.
Counselor Allen?
Dr. Worsley, Is there a way we could work with the swim community to utilize their expertise in fulfilling the lifeguard on duty and ask them to support us in volunteering and not having to pay?
Our department, Council Allen, checked with our risk management department before, when this came up with our commission. That was one of the questions, if we can utilize those individuals from a volunteer standpoint. And our risk management department here at the city was not on board with that. And we also checked with our legal counsel to bring them into the loop regarding that as well. We were told that that would not be advisable
What was the reasoning?
for more reliability on the city, perhaps.
I'm not sure I understand the difference in liability. If someone's there as a volunteer, someone's there as paid, and there's a situation, there's still liability with the city.
I think in terms of with the city, and we have more jurisdiction, more oversight with our staff, making sure they have their certifications that they may need to have more from a management oversight perspective. With volunteers, we may not necessarily know what they have, or may not necessarily have from a management standpoint.
Well, I guess what I was thinking is if you had a core group of folks that would volunteer to serve as lifeguards during certain hours, instead of having one or two, you could have 5 that would volunteer to come in. So you're not having to pay 5 to be there. You have them volunteering to come in. They would serve. They would get some type of credit or some type of discount with the swim community, or maybe even you could give them a discount swimming if they would serve. That would be some form of compensation, but it would take it off the city hourly amount.
Well, I think the city manager wants to say, we'll certainly take a look at that, and we're open to all sorts of partnerships. But, Mr. City Attorney, I think you need to inform us about whether or not there's any possibility someone would claim a waiver of immunity or somehow working around immunity if volunteers were being used to do something that would otherwise be an employee function. We know our employees are covered by sovereign immunity, but I could see someone arguing, whether it be sustained or not, that using a volunteer who's possibly not trained or so on and so forth might fall outside your sovereign immunity. So I don't know if you want to discuss that.
Well, certainly if there are employees and they've acted in good faith, they are protected under Georgia law by official immunity. Now, if there's somebody's private employee, not a public government employee, they would not be protected by that same immunity. It would be up to the private entity to purchase liability insurance to cover those people for whatever they did. And I would hope that if there's any contract with a private group, that would be one of the requirements, that they have liability insurance in a sufficient amount. But the government usually does not purchase liability insurance because that can be argued as a waiver of immunity, but the official immunity does cover employees of the government as long as they're acting in good faith, and that defense is not available to employees of a private entity.
Well, I understand the legal side, Clifton. I'm looking at this as the natatorium as a place, as a ball field, for example. We have Little League and soccer and football. You have volunteers going there, and you have parents looking out for those that are out there participating in the sport. And they're not employees. They're all volunteers. Now, I understand the difference that you have water and that you have to have a lifeguard, but we don't have any paid employees there supervising or doing anything in the other sports.
And Councilor Allen, let me just say that, I think we can take a look. I think we still got to have enough employees to cover the safety requirements and provide the level of service that we need to provide to the users. And if we can get volunteers in a way that we can all get comfortable with, I think we ought to do that. And so we'll take a deeper look. But, it would be in addition to what we know we need to know that people are going, our employees are going to show up on a day-to-day basis. They're going to be able to open the doors, and when our citizens, users get there, we've got what we need to manage the facility to the level of expectation that you have and they have, and volunteers would be just to allow us to provide even a higher level of service. So I think we got to have what we got to have to do the job. But certainly, I think if there's an opportunity that we can all get comfortable with, using the example that you've used with Little League baseball or football or whatever, we'll take another look, and we're willing to do that.
I appreciate that, Isaiah. What I'm trying to think about is a way to cut the cost, and if let's just say, for example, the hurricanes are coming in to utilize that 2-hour segment with whatever variety of teams they're going to, if we contract with them to utilize the facility, then they would understand that they have to provide the lifeguards and everything for that amount. We can stand at the door and let them in and make sure everything's clean and everything's operating. But once they enter the pool, everything's on them.
Yes.
And that saves us from having to have personnel there to operate.
Well, let us take a closer look, and whatever we come up with, we'll have a written understanding that all of us agree to, and we know what position we're in if and should something happens. But we'll take a look.
Okay.
And I don't want to run it in the ground. I'm going to leave your mic open because I want to elaborate on it a little bit. I really believe that's one of the greatest assets that this Columbus Aquatics Commission brings to the table, because I know when we were stretching, trying to get enough hours, it seemed to me that if you leverage some of those volunteers, and if they wanted it for 2 hours for training in the morning, and if you're tracking by day part the number of people who are utilizing that natatorium, I think that there's a smattering. I've been over there maybe a dozen times, usually early in the morning, of folks that will swim for exercise. There's some seniors or some business people that come in there and use that for their exercise in the morning. I don't know why you couldn't do exactly what Councilor Allen is indicating, and that is if you've got acceptable certification from the coaches, and I think I've heard that all their coaches are certified by the American Red Cross as lifeguards, and if part of that memorandum of understanding is that they will also allocate 1 or 2 for the general use section of the pool while they're doing their training on the other end, it's just a great way to leverage. And I think as we go forward, and the mayor's been very, very clear, and she's done a great job with the city manager and the finance department in presenting a budget, a very austere budget, we're going to have to shift the way we view the world. We're going to have to evolve. And I know that government's default, and I respect everybody that provides this answer, but government's default answer is no. Because if there's any hair on it at all, if there's anything that's out of the norm, our default is to do what we've always done because it's safe, it protects us, and we feel like we're not putting anybody in any kind of danger. But I would submit to you that as we continue to look for ways to provide these quality of life opportunities, and frankly, crime deterrence, because your department has as much to do with crime deterrence as our crime prevention program, because of the opportunities and the mission that you fulfill in trying to make sure that these kids have positive opportunities to direct their energies. So I just want to urge us all, including our city attorney, instead of looking for reasons why we can't do something, let's look for what we'd have to do if we were going to make it work. Because if this doesn't happen now, it's going to happen going forward, I think, in order for us to continue to keep these things open.
Yeah. And there may be great examples out there, and we'll go look for them. So,
well, Corda uses volunteers, and they actually do, and I don't know much about tennis, I don't play, but they actually use volunteers, I think, that go out and kind of work on courts, clean courts, and do stuff like that. I don't know. Yeah.
So certainly we do intend to do exactly what you're talking, and so and we'll follow up with you when we get things in place that we're all comfortable with, and yeah.
This proposal assumes there will be a high level of volunteerism, that's sort of built into the credit of the extra $100,000 revenue that this model's provided, is that those volunteers are showing up, reducing the cost of doing business, and also adding to the enhancement of programming, which can bring in additional revenues through either meets or special swim programs of some sort, kayaking lessons, whatever it may be. We had some wonderful suggestions from what's now going to be the commission. So volunteerism is absolutely an essential part of what's been proposed.
I think all we're saying is let's don't limit that to some of those individual projects.
And you know, I'll just mention, when I visited the NIAA, I mean, you had volunteers from everywhere with red shirts on.
NAIA, right.
NAIA, assisting. And so we do use volunteers, and, you know, we need to, Councilor Allen, exactly what you talked about, and Councilor Henderson and others, I think we can work that out.
Well, if you talk to a local Little League when they have a state tournament here, there's nobody is paid. There's no paid staff there at all. It's all made up of volunteers. They come in and work different shifts in the concession. That, you know, I think it's worth sitting down and talking to the Aquatics Commission about.
Sure, absolutely.
Thank you.
Absolutely, and we will do that, Councilor Allen, and as City Manager Hughley said. And I think this is, we have to do, you're correct, look for innovative ways to do business differently, and I totally agree with that. So I don't want you to think that I'm not, because I think innovation is great. Also, at the same time, I just want to make sure that we're balancing our innovation with also looking at things that are safety concerns. When we start using volunteers, perhaps talk about using volunteers as lifeguards at the Aquatic Center, we have to stop and think sometimes if the lifeguards don't show up that are volunteering, we can't operate the facility. And so that's where the management piece comes in from a supervisory oversight that concerns me as the director and my management staff. Volunteers are great when we start running an event like at the softball tournaments, like when NAIA came into town, we use volunteers heavily. But when you're talking about the day-to-day operation of the facility, we have been in the press immensely over the last few years regarding things at the aquatic facility. I just want to make sure that we don't go down the road using volunteers to do some of the things that I would consider more of a high-level safety risk concerns that will get us into further trouble and not use the correct management staff and the models that we see from a nationwide perspective. But as you said, we will look at further in this innovative way of looking at doing business differently as well.
Mayor Pro Tem?
Thank you. In the staffing models you looked at, if you go back one slide,
I'm sorry. Here, is that correct? Is that where you want to be?
that they all require that you have a manager and then the 2 assistant managers.
I'm sorry, Ms. Pugh, could you repeat
The
that again?
staffing models you looked at, they all required to have a manager and 2 assistant managers.
The models we looked at over throughout the nation are various. There are some that have more management. There are some that have what you see here. I don't think we would be hard pressed to find a model that would have less management. I think we're at the minimum management structure that we have here to operate with the number of hours that we're paired with. There's not one, just only one carbon copy management structure in place nationwide. There are multiple. And I think we've taken a hybrid of what we've seen and worked with the mayor, the city manager, and others that we've seen across the country to make something work here for Columbus.
Okay.
Continue.
Proceed? Okay.
We've got, I'm sorry, Councilor Allen.
What is the number of hours of operation?
89 hours per week.
Okay, and that's the 1.2 million. What's the deficit? What's the loss?
In terms of the 1 point, let me go to the next slide. Let's see. Okay. Okay. On this particular slide, we take a look at what the budget is, line item for the Columbus Aquatic Center, everything from wages and benefits to promotion, advertise, instructor-based programs, the software that goes to run it, our training, printing, office supplies, operating materials, supplies, utilities, uniforms, and medical supplies, and that gets us to the 1.2 million that we discussed earlier. And let me pull the revenue for you. The projected revenue that we have for this as well is $277,000 for the year, for FY17.
So we're looking at roughly $900,000 loss.
Did you do the balance on that? That's right, 965 is the number with the subtraction. And with any of our services that we provide, Parks and Recreation, when we have revenue involved with our enterprise services, we hope to, over a period of time, to shrink that loss. And I think that will come with great management in place and when we increase our programs at the facility as the numbers increase in the future.
Have we thought about lowering the hours from 89 to 70 or whatever another number would be to try to make it a little more realistic budgetarily?
We've had that discussion here at council regarding taking the hours down from 89 to a couple of different options that we looked at in the past and what that might look like. And part of the conversation was, yes, the numbers go down, the revenue measures go down as well as the expenses. But what was determined in previous conversations with this council and with the advisory board commission is that we don't want to decrease hours. That's what we've been told. We don't want to decrease the hours. We want to keep the 89. And I think that's why you will find in the mayor's proposed budget that we're going back with the 89 hours after the public has spoken to us. And because we could not get a decisive answer which direction to go, we put it in the budget to move forward with the 89 hours per week.
Okay. In the discussions as we talked through the budget, if we were able to come to an agreement, let's say 70, are you looking at having a manager working 40 hours a week and then 2 assistants working 40 hours each a week? I'm sure they'll have staggered shifts, but if we lowered the hours, is what I'm trying to say.
That's right.
Would we be able to get away with only 1 deputy instead of, because you're going to have a manager that's going to be marketing the facility.
But they do 2 different jobs. One focuses on the facility, the other focuses more on the program aspect. So even if you lower the hours, 70 hours a week, still awful lot of hours. You still need those 2 people to do the job and do it well. I don't think that we're at a point in Columbus to not get this right. If we've started out with opening a facility with third-party management company, that didn't work out. Now we're almost like having a re-grand opening. Parks and Rec has stepped in to do it in an interim basis. It's been a year so far. And now we're looking at doing something different and making that decision what that different something will look like. I think we've got to put the money forward. We've got to get this right so that we don't be back at the table a year from now saying, how do we get this wrong and what should we do going forward?
Well, and let me just say that I agree that if we lowered it to 70 hours, the staffing structure would not change. It's like if you lower it to 70 hours, you're not necessarily going to change your water usage. But, you know, as Director Worsley said, I mean, we got off to a bad start, and we've now brought in an aquatic center commission, and you've given them some direction and how they are going to integrate and work with Parks and Rec management. And this is an opportunity to get it right. And we start out with, you know, that projected deficit. But if we're able, with the Aquatic Center Commission and with staff working together, get it programmed right, get the usage up, and I think we're going to see that number shrink. And it's kind of like, you know, I think about the Civic Center. You know, they start out each year, and we project that we're going to bring in certain events, and you start out with a $5 million budget, and if you get it right, the Civic Center is not going to have a deficit. If things don't go quite well, then they're going to operate with a deficit. And so I think we've got an opportunity here to get programming right, well, get the structure right, and the hours right, get the usage up, get programming right, and if we do all of those things well with the Aquatic Center Commission working with us, I don't think we're going to see that kind of deficit. I think we're going to see it start to shrink, and we hope that we can get to, someone mentioned to me in another city, I can't remember, in Georgia, that they were bringing in, $500,000, $900,000 in revenue. Well, if we do this right, I think we can move in that direction as well, but we got to have a chance to get it right, and I think this is it.
Well, Isaiah, I applaud the effort that's been presented, but my thought is this is a proposed budget, and we're talking through what we can afford and what's the best route, and that's what I'm just trying to throw out, ideas that maybe councilors can think about and see if we can come, and Dr. Worsley can think about and see if we can come to some agreement. If I recall, Dr. Worsley, when he first came, made a presentation to council about funding the natatorium, and it was a $2 million budget with a $1.2 million deficit, and we can't afford that. And now the only difference in this presentation and that one is it's $965,000 deficit, and you're still funding the same number. I mean, it's the same number of hours. I'm just trying to see if there's a way to work closer with the commission, utilize some of the suggestions that were presented. I'm not stuck on 70 hours. I mean, if it's 60, help us get to that point that you just described. Let's don't start out at 89 and run a $965,000 deficit this year. Let's start lower than that and see if we can grow in that direction. I'm still not convinced that a third-party administrator is not the way to go. The one we hired didn't work out. That was a bad decision. But there are plenty out there that do the job, and if we're gonna go in this direction, then I just want us to go in it eyes wide open. I don't like operating with $1 million deficit. That's concerning.
And you're right, it is a proposed budget, and so all of this conversation is very good as council sculpts what ultimately will be their budget to decide. Just a couple of comments. There is no company that runs an aquatic center in the state of Georgia. There's some that contract to staff the lifeguards. There's some that contract to staff pools in various capacities related to military installations. But there's nothing in the state of Georgia that would run an aquatic center, and there still would be a, quote, deficit even if there was a third party, because they're not proposing that they would be fully net neutral by their revenues, and to the extent they are stating revenues, they seem to be wildly inflated from the research we've done, and certainly from our historic past, which would be troublesome for budgeting purposes. If we had a year and could see that they'd really bring in $500,000, $600,000, that might be responsible, but we don't have any indication those numbers are well placed. So that's one of the reasons the proposal is as it's stated. I would say you're right in that it's a deficit, in that it's not being funded by the revenue it's bringing in, but I would say that that delta or that difference is funded in this proposed budget so that it's not coming out of the reserve. It's funded through other means, which are set out in the letter. So I just wanted to be clear that the difference between the revenues and the expenses of running this facility are funded through other proposed revenues as set forth in the letter.
I understand that, Mayor, and I think that has been a lot of concern expressed in the city since that was made public, the funding mechanisms that are used to fund the natatorium. It's at a great cost to other entities. For example, the $100 assessment on all the teams. I've heard from the Little League community, the football community, youth football community, and others, soccer community, that for example, the District 8 Little League administrator said 3 of his Little Leagues will not exist anymore. They can't afford to pay the $100 fee. So where are those children going to go if they can't go play sports? They can't participate. We all know where they're going to go. And it's going to cause a problem in other areas. And hopefully they won't rise to the level of the juvenile court, but at some point there's going to be a cost associated with those leagues going out of business. And other leagues will lower, they can't afford this. You're adding, one league, if you have 50 teams, you're adding $5,000 to their operating expenses for a year. And they're operating at a break even now. And it's just cost prohibitive for them to absorb something like that. There's no justification for a $100 per team fee that's been offered at this table. Why did we start at $100? Of course, if we start at $25, we know a governmental fee is only going to increase. So at some point down the road, it'll probably be $100. But it's going to drive the leagues out of business. A lot of these leagues take their equipment and they give it to the poorer leagues so they can continue to work with the youth. Parents spend hundreds of dollars a year on equipment so their child can play sports. That sales tax on that equipment comes back to the city. Leagues spend thousands of dollars a year on their fields. The city doesn't have to spend anything on a lot of fields. The leagues spend thousands of dollars. I think, if I remember the number right, in the proposed budget, it was $50,000 that this was going to generate. The leagues are spending far in excess of $50,000 on these fields. And I've asked them to come at a later time and present that to council so the council can hear the information from them personally, not from me. But in that vein, Mr. Budget Chair, I would like to put that $50,000 on the delete list, that line item, $100 per team assessment.
If it pleases the chair as well, I actually have that as part of my presentation. I would like to have the opportunity to present that prior to it going on to delete list, if that's okay.
Well, we can put it on the delete list. We can remove it too, just as easily. It's simply an administrative function at this point until we get to the final meeting. So, I mean, there's no reason he can't put it on there, but you can still address it.
Okay.
Because there's been no vote yet as to whether or not that will pass.
Okay. Since we are talking about the
I'm
leagues,
sorry, we've gotten several folks.
Let me just say one more comment. The reason I was bringing up these other ideas, a way to utilize volunteers and try to lower the cost, was because I was going to ask for the $100 per team fee to be put on the delete list. So I was trying to not just take it away, but
Gotcha.
come up with some alternative. Thank you, sir.
Yes, sir. Okay, we've got Mayor Pro Tem.
When we talk about the hours of operations, I'm still not convinced that we need, 89 hours?
89 hours is correct.
Because I know right now, we don't know how many hours we need for operating, right? Because we have not been keeping up with the time of day when hours of usage.
We have been keeping up with the time of usage. We've actually presented that to council in past presentations as well. I'm a little confused because I'm hearing now that 89 hours might be a little too much. We're not necessarily know what our hours might be, and the swim community has told us, the chair is here from the task force that supports the 89 hours for a week, and that is the direction that we've kind of sailed towards at this point. So I'm hearing a little something different today.
And you're likely to hear a lot more different.
Okay.
That's what this is
for.
for the Budget Review Committee to address some of these. Now that we've seen the entire puzzle pieced together by the mayor and by the staff, we are going to take these on individually, and some of them, the Aquatic Center's been, a focal point for a while. So, and I know I've spoken with 3 different members of the swim community who have indicated that certainly they support 89. But they allowed, without me asking, that 75 hours, 70 hours is more in line with what they were expecting and what they could make function. So I think these are reasonable questions. All we want to do is kind of work through them and see if we can come to, because I suspect that if we cut it to 75 hours or 70 hours, I don't know that that's going to be a significant reduction in operating cost, because you still have materials you're going to save on personnel. But I think the exercise is positive to allow us to try to see what, if anything, can be saved. Because as Councilor Davis had pointed out earlier, that just a little bit here and there, we may be able to piece something together that everybody's comfortable with. Mayor Pro Tem, were you finished?
Mm-hmm.
All right, Councilor Davis.
Mr. Budget Chair, I have somewhat of a universal question, but right now it pertains to Parks and Rec. But out of respect for the director, I'm okay if he proceeds, but I can certainly ask the question. It's not really in this presentation, but it does deal with the budget.
That's fine, no, that's fine, this is
Whatever your
appropriate.
preference is.
No, that's fine. If you have a question, we've got the director here, and if it's something concerning Parks and Rec, I'm sure that,
Well, I know somebody's going to give me an answer, but I'm just curious in looking through here. I know that we've gone through some exercises, and, well, we've made some changes in the past to, to deal with some of the shortfalls in our budget and in our revenue, mainly in healthcare and retirement. Healthcare contributions as far as the city goes is down, and when it deals with the actual employees, their contributions are higher. In some cases, in respect, with some employees, retirement is higher as well. I'm just looking through your budget. It just happens to be your first in line, so I'm using your budget. But I think it's a general question, universal in nature as in respect to this budget. But when I look at your different operations and all, and I look at your salaries and I look at your wages, but yet I've noticed across the board there's a tremendous increase in the budget. Somewhat let me go back. The salaries and wages are somewhat consistent. In other places they've increased. But even if they're consistent, there's a considerable increase in group health care insurance, as well on the opposite side. On the opposite side, on retirement, there's considerable decrease. So help me understand that, what's going on.
Sure. The contribution for budgeted position for healthcare last year was $5,650. And this fiscal year, it's $6,500. So there was $6,100. So there was an increase in the cost of insurance. And as you recall, last week when the Shaw Hankins was here, they talked about the fact that we come back at the end of the fiscal year and have to make up that difference. And so the $6,100 is the cost per budgeted position of the projections for healthcare going
So
into
that-
FY17.
Okay, that's only a projection now, because at the turn in 17, isn't the cost of health care going up, the contributions going up, not from the city standpoint, from employee standpoint?
The city's contribution from a budget standpoint went from $5,650 to $6,100, because in prior years, we would come back after the fact, and we were actually paying almost $6,100 per employee after the fact. And so to maintain the 70-30 split, the city's contribution would be budgeted at $6,100, and the employee's contribution would be the 30%. And we
So-
talked about that last week.
So you're saying that's a projected number right now?
Yes, that's based on their actuary reports. That's our projection for
So
healthcare.
it could come in a lot less?
It obviously could come in less, and if there's some high-dollar claims, it could come in more, but based on the reports and the actuary
Right.
that they have utilized, that's their projection going into FY17.
Okay, well, I'm somewhat grasping what you're saying. I'm still looking through here, even in the years in the past, it's still a considerable increase, even though we've made changes from a standpoint of the city's contribution. How about on the retirement side?
The retirement side, there was a decline in the retirement contribution for both general government and public safety compared to FY16. So they almost offset each other. The healthcare
why
is
is
almost based on the actuarial assumption and the actuarial report that we get each year. That was our required annual contribution for FY17.
Okay. Thank you, Mr. Budget Chair. Thank you.
yes, sir. Councilor Thomas?
Dr. Worsley, I have some questions about this chart, but I don't know if if you have finished your remarks on those. If not, I'll wait until you do that. But I do have some questions about some of the items on this.
You can go ahead. I was going to move forward.
On the $35,000 for instructor fee-based programs and the $10,006 for supplies for fee-based programs, I assume that at least one of those fee-based programs are swim lessons. Is that correct?
That would be correct.
Are there other fee-based programs?
Yes, they all have not been molded out or planned yet, but to give you some examples of fee-based programs, this is what we know we need. We have an idea based in what we've done in the past in terms of what we put together from a program standpoint. There's opportunity, say, for paddleboarding or paddleboarding, learning to paddleboard classes. These are classes that we would have instructors come in. We would have, of course, paid instructors, and of course, we receive revenue based on that as well. Also, there are other classes like log rolling. There are classes for individuals that want to learn how to get out on the river to whitewater, where there are classes to learn to do the canoeing or perhaps the, what was the other? Kayaking as well, to be able to learn to do those things. The fees, scuba diving and those type of things. Supplies come into play because you have to be able to purchase the necessary supplies to be able to do those particular classes as well.
And, excuse me, this $35,000 for the instructor is in addition to the $643,000 in salary and wages, correct?
Yes, that's correct. The instructors are not our employees. They will be people that specialize in doing that particular activity.
Okay, and I believe that you said, and correct me if I'm wrong, some of this will be, well, that's the word, that's the wrong word. We charge the fee that goes into the general fund. However, that does not necessarily offset cost in the aquatic center. Is that a correct statement?
That's correct.
Okay.
We don't receive the funding directly back to Parks and Recreation.
Okay. The other question that I have is on the education, training, travel, and conferences. I notice in your budget document here that there's $3,000 for education and training and $5,000 for travel and conferences. What are we paying? What kind of training are we paying for the aquatic center?
Say, for example, our employees, particular lifeguards, have to be maybe certified pool operators, AFO, aquatic facility operators. We have a full-time staff that hold those certifications, and we as a department assist them in maintaining that. They have to go out to educational sessions to be able to get the continuing education units in order to support those certifications. And also, with our lifeguards, any trainers that we might have to bring in, we're paying for trainings or sending someone to train at a particular location regarding anything in an aquatic field that would help them do their job better here in Columbus.
I'm not a lifeguard. I can swim a little, but it would seem to me that if I were applying for a position in the aquatic center that requires some kind of certification, that it's my responsibility to get that certification before I apply for that job. Is that not what we don't require our lifeguards to have this certification before we hire them?
We have done that in the past. We also train in-house as well, train for them to be certified as lifeguards as well. Yeah, you want to, is that not correct? Anything that's wrong? Okay. We have such a high turnover in that regard as well. But again, much of that $8,000 is, I know we're looking at every dollar, but for a large staff of that nature, the lifeguards is just a portion of that.
And what kind of traveling conferences are we paying for?
And it is continuing education as well. I'm sorry, I didn't catch the last question.
What kind of traveling conferences are we paying for the aquatic center?
Okay. Holly, who has her certification, I'm going to let her come up. I'm sorry, Holly, I know you have your crutches. If you bear just a moment. Holly is a guru in the field of aquatics. She is a certified pool operator on our management staff, and she also holds a national aquatic facility operator certification, as well as one of our other staff members, Matt Lynch, who also holds this national certification. I'm going to let her tell, since she holds the certification, I think she's very the person to tell you a little bit more about what's all entailed.
Good afternoon. To have the certifications that Dr. Worsley has referenced, you have to have continuing education credits, which means you have to go to class. You have to have so many CEUs. So for example, to hold your AFO, you have to have 2.0 CEUs. A class is typically 1 hour or 0.1 units, so that equals 20 classes. And so you would have to travel in a short period of time to get all of those to maintain that certification, to basically hold your certification for that position, basically. Also, there's a lot of equipment that he didn't reference as far as lifeguards, because you asked about lifeguards. We like to train our lifeguards in-house. As was mentioned earlier, there's very high turnover with lifeguards. They're high school kids, college kids. They go through high school, they go off to college. We lose a lot of them, so we start over. And some of that is equipment. We have to buy dummies and things from the Red Cross to be able to do first aid and training. And obviously, they wear out, and so they have to be replaced.
Well, one of the things that Dr. Worsley said is that we are looking at every dime. And I will just tell you that when I was a school teacher, I had to have continuing education courses. I had to be recertified every 5 years. And the school district did not pay one dime toward that certification for me. And perhaps it's all well and good that we do this, but some of that, as we are trying to find the money to do what we need to do, might fall on the employee. I'm not proposing that. I'm not saying put this on the delete list, but as you know, this is one of my pets, and I just think we need to be overly cautious about what kind of, because this is $8,000 in the aquatic center. There's more money in your overall budget in other areas for training, for travel and conferences and all that kind of stuff. And, you know, it adds up. Last year, we paid over $2 million citywide in travel, conferences, and education. And I just want us to be deliberate, I guess is the word I'm looking at, when we do this, that we don't just, you know, well, we've always done it this way. This is money that could be allocated in other directions. And I guess that's why I'm asking you, and if there are any other department heads that are listening, they're going to be asked by me, what are you doing here, so that we can be cognizant of the fact that we're doing this. You know, one of the things that my association did when we ran into some budget problems is we said no out-of-state travel this year. No conferences out of state this year. This year. Next year, if we have money, maybe you can go out of state again. But this year, we're not going out of state for conferences, and that lessened the cost. All I'm asking you is that you be painfully, if that's the right word, aware that somebody's taking a look at this stuff.
Well,
And I'm not in any way, and please don't take this the wrong way, I'm not in any way insinuating that I think you are doing anything, you know, illegal, immoral, or fattening, you know, as my grandmother used to say. It's either illegal, immoral, or fattening. I'm not saying that. I don't think that you are going to things and training people that don't necessarily need that. I'm just saying we need to be very careful that it's something that we need to be paying for.
Well, and let me just say, Councilor Thomas, I hear you, and were we not dealing with high school kids and college kids who are coming and who are going, when we talk about lifeguards and we talk about continuing education, and were we not dealing with the precious life of babies and grown folk and older folk? Now, $8,000, I mean, that's a lot of money, but with the number of lifeguards that we are talking about in an aquatic center our size, and with the amount of turnover, $8,000, we're going to scrutinize how we spend it, but we've got to make sure that they're properly trained, that we are providing for safety of the users, the citizens, and the one thing that none of us want to hear is that we had to shut down early, or we had to turn people away because we don't have enough lifeguards. And we've had that problem. When kids are ready to go back to school in August, back to high school and back to college, we've had to shut down some of the pools and direct everybody to one pool because I've talked to staff, we don't have lifeguards. They're all going back to school. We don't have any. We can't find any. I mean, we've gone through this year after year after year not having lifeguards. And I know some of you know that because your kids have worked over there, and they'll tell you. Councilor Henderson and Finance Director or Deputy City Manager Hodge, if your kids have worked as lifeguards for us, you know we don't have enough. And so, yeah, we've got to have money to train and retrain and continue education to make sure that we can open the facility and provide for safe swimming.
And please don't think that I meant that these folks should not be certified. That was not part of this at all. But it does seem to me that if you want to apply for a job as a lifeguard with the city, one of the prerequisites is that you be certified. Thank you.
Yes, ma'am. And Holly, I'm sorry that you've hurt your knee, and please don't hobble back up here so you can nod or shake your head. This is yes or no. Are we still doing with the lifeguards? We did have a program where we tried to provide some incentive, like we paid them a certain amount, withheld a little bit, and if they stayed through the end of the season, they got a lump sum payment. And then they also got some extra consideration in consecutive years if they came back, so we could retain some kids with some experience. And that way, hopefully we got them all the way through their high school years and even into their first year of college. We still doing that?
That is correct. We do the quarter raise for each annual year that they come back to us, so each season that they have with us.
Right.
We do that. We don't do the lump sum, as you mentioned, the first part.
Yeah, I don't remember what it was. It's like they made, making this up, I don't remember, but like $7.25 an hour, and they collect $7 an hour on their pay, and then if they work to the end, they got that as a.
We don't do the first part, that part, we don't do that.
Well,
where we
I
collect so
only
much.
say because I know a lot of kids right before school starts,
Sure.
a lot of them would go to the beach and take off, and that's when the numbers would really drop. So I don't know.
Certainly. Yes, but no, we do the quarter raise each year when they come back to us, so each consecutive year that they stay with us, that's their incentive to return to us, and we do acquire a lot of our lifeguards in that way because that is a lot more money for them
Right.
per hour.
Thanks.
Yes, sir.
And Mr. Chairman, I will say, one of the challenges we have had, and that staff talked to me at least a year or so ago, we were paying lifeguards less than anyone in Columbus and Phoenix City. And we needed to get the hourly pay up. You all came to me because we couldn't get they were going other places first, and then when they got filled up or they hired all they want, then they come to us for the low-wage lifeguard jobs. And that has been a challenge for us getting lifeguards, and so we worked at that, and I don't know that we're there yet. And she's saying no, but we don't want to talk about pay, but we're the lowest paying lifeguards. The YMCA and everybody pays more than we do.
But on
for
the other
lifeguards.
hand, they are overworked.
And overworked, you're right. And so that's a challenge. We
I
are
know.
challenged.
That's right.
We are challenged getting lifeguards to work for us. And so it is what it is.
I don't want to do it, but we can harken back to what Councilor Allen was talking about. We got coaches in the swim teams that might leverage that. Councilor Woodson.
Yes, and I don't mean to be disrespectful to anyone or anything like that in my comments, but this is the reason why, with the comments that Councilor Thomas made and Gary, and it's kind of around the table, this is the reason why I feel it should be privately run, that the city